minutes.
Thank you, Mr. Chairman. I appreciate that. Thank you all for being here, and thank you, Mr. Isaacs, for the work that you all have been doing there for 11 years. Samaritan's Purse is a good organization, and appreciate what you all have done.
Thank you.
Not just there, but around the world. Speaking of that, in your written comments, you said many public health experts are telling us that we know the disease, how to fight it, and how to stop it. Everything we have seen in this current outbreak, however, suggests we do not know the science of Ebola as well as we think we do. I touched on this earlier in the previous testimony related to, I believe, the reservoir species is what Dr. Frieden was talking about, and that we don't know the full extent of the reservoir species. And you touched on that in your written testimony as well. And you asked the questions, can the virus live in other mammals besides primates, bats, rodents, and humans? And you attached a study related to pigs. Do you ask this question because your people on the ground have some questions, or just because it's a blank slate and we really don't have much research on it?
I think that Ebola is potentially a much more serious disease than it is given respect for. What we are seeing is that it is flexible, it is deceptive, it's sneaky, it's agile, and every time somebody thinks they have it figured out, it shows us something new. And I think that we, as a society, cannot make assumptions that we know what it is and what it will do. I think that we need to be extraordinarily careful about letting it come onto this shore. And while it is true that when it has come here, we quickly identified it and isolated it, the truth is, as these doctors could tell you, particularly the gentleman from Texas, that if he had 10 or 20 or 50 cases down there, it would consume his capacity to isolate it. And so while we can isolate it, if it were to get out from under us, it would quickly exceed our capabilities. And that's why I think it is so extremely important to invest resources to fight and stop this disease in Africa before it gets off that continent in a major way.
And I appreciate that. Have any of your people there in Africa indicated to you that they're concerned about animals that might be carrying the disease, or is that just a question?
We live Ebola 24 hours a day. It's all we talk about. We talk about it all.
Right.
And yeah, we are worried about it. We don't know. Evidently in Spain, they thought the little dog, they killed it. In Texas, you put it in isolation, and I'm glad the lady got her dog back. I'm a big dog guy. But who knows? Maybe there's some science on this, but I think that we don't know.
Well, I would refer you to a study that came out in March of 2005 in the Emerging Infectious Disease. I guess that's the name of the publication, but it's a CDC publication. I'll be happy to get you a copy of it. And it's available, where they talk about the potential of dogs, and it says that although dogs can be asymptomatically infected, in other words, they don't get the disease, and sometimes the science gets confused on television. They don't get the disease, but they're carrying the antibodies for the disease. And this study says asymptomatically infected dogs could, doesn't say they are, could be a potential source of human Ebola outbreaks and a virus spread during human outbreaks, which would explain some epidemiologically unrelated human cases. And it goes on and it talks about there are cases in the past in Africa where they don't have any idea where the disease came from. And I asked Dr. Frieden about that, and he said that, maybe bats, but they still don't know what all the reservoir species are. In a prior hearing before today, when we were here in October, I said, what are we doing about animals coming into this country? And it was more or less laughed off, but it is a concern. Wouldn't you agree, Mr. Isaacs?
I do agree, and I'll tell you why it's so important. This is not the flu. This isn't influenza. This is a disease that kills 70% of the people that get it. And if you look at what the disease has done this year, and 5,500 people dead, 13,000 cases, that's extraordinary. And none of us have swam in these waters before, and I don't think that we can use case studies that come from 1976 to today to make assumptions about an unprecedented event that crosses national boundaries. It's now in Mali, when you look at the disease, the caseload may be going down in Liberia, but the disease is in fact spreading geographically. We fear that very soon we will see it in Sierra Leone, and it's already been identified in Mali.
Well, and I appreciate your comments on that, and I liked your term travel management, because I do believe we want people to be able to get there to provide humanitarian relief like your organization does. At the same time, I think we have to be very, very careful. And with that, Mr. Chairman, I yield back.
Chairman yields back. Now recognize Mr. Tonko for 5 minutes.
Thank you, Mr. Chair. State and local